I hear you now. Thank you.
Shannon, we'll start in just a few minutes. We're waiting for somebody else to come, so we have 5 present. We're waiting.
Okay,
We're
thank
waiting
you.
for a minute.
All right then.
Oh, but do we have to have 4 people, or can we start? Oh, never mind, Shannon. We're going to start. Yes, we can start. Okay. Well, because it's the committee, not the full board.
Oh, that's right.
Yeah. Yeah, so we just have to have 4. Okay. All right. Is everybody ready? You guys ready? Oh, and there's Dr. Martin.
He's not wearing
Perfect.
a white better.
Okay.
A white
Good afternoon. Good afternoon. Today is September 25th, and it is 4 o'clock, 4:04. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Budget and Finance Committee. As a reminder, some of our committee members may be also participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. I'd also like to announce that in order to make it more accessible to community members, we will hold public communication for the Budget and Finance Committee, Executive Committee, and the Board of Managers meeting at a time certain of 5:30, unless a member of the public wishes to comment on a specific item on this agenda. We're now going to proceed to the Budget and Finance Committee agenda. The first item is to approve the minutes of the August 21st Budget and Finance Committee meeting. Motion from Manager Valadez, second from Manager Martin. All in favor? Aye. The first item passes. Second item is to receive a presentation on the August 2024 financial statements for Central Health. Managers, there's no presentation at this time for this item. The materials are in your backup, and staff are available in case anyone has specific questions. Does anyone have specific questions on the financial statements? Not seeing any, we will go back to, yes.
I'm sorry. I apologize. I just wanted to make sure that somebody could tell me whether or not we could, or whether it was a possibility to do future financials when we're talking about the University of Texas system, that all the contracts be itemized so that we
Okay.
can see.
Well, let's see, who do we need? Is Jeff, there was a question? Did you want to ask him, or do you just want to make that request?
No, I've asked that before, but I just wanted to know whether or not we can do that.
Okay.
We
Did you
will
hear-
do that.
Did you hear a question, Jeff?
Yes.
Okay.
Chief Financial Officer, yes, we can provide that detail. Thank you, Chair. So this item is an administrative item that we're requesting approval. When I say approval, I really mean ratification of a debenture that was previously issued. And so I'm going to just walk through some kind of history on this, and then the request again is just somewhat of an administrative cleanup related to one of the debentures. So debentures are instruments that Central Health has issued related to capital requirements for Sendero. There have been 2 debenture issues. The first issuance was in 2015, and there have been a couple of amendments to that. The amount of that debenture is a little over $17 million, $17.1 million, and there was action taken, I want to say at the last meeting, but that's not really true. It's probably been within the last month or so, of an amendment where the board approved amending the terms of debenture number 1. And those terms were amended so that the actual debenture or repayment wasn't triggered. So that's debenture 1. It has a long history from 2015 to just last month. What we're talking about tonight is debenture number 2, which doesn't have as long of a history. Debenture number 2 was, again, 2 of 2, was a $20 million debenture. It was issued in December of 2018, again in the amount of $20 million. In that period, this is Central Health's fiscal year 2019, Central Health budgeted and made the payment for that debenture in December. The action so we have the payment, the budget, we have what I believe, sorry I can't remember back that long, I feel like surely a presentation. It more than likely would have been in closed session. But nonetheless, we don't have the actual debenture document that has Central Health's CEO and President's approval on it. And so what I'm asking for tonight is a ratification to delegate to Dr. Lee the authority to execute that document. I really think this is we're crossing our T's and dotting our I's in the event that we ever have to go back and amend this debenture. And again, the second debenture, this debenture number 2, nothing gets triggered until debenture number 1 is satisfied and is paid off. But nonetheless, just from a regulatory standpoint, and I know that Sendero has expressed a lot of desire let's just move on. The document more than likely was misplaced. The debenture was approved by TDI, and they have to have all parties involved approval. And we have some documentation that reflects it was approved, but I can't hold the actual document in my hands, and that's what we're trying to resolve tonight. So just to kind of repeat what my request is to ratify and delegate authority to Dr. Lee to execute or sign the actual document that has already been approved by the necessary regulatory agencies, but gives us the documentation. And then the last thing I'll say is that we did go, Sendero did go through a kind of a regulatory audit, and we thought that if we asked the regulators for a copy of this, that might work, and that didn't work either. They did not seem to be able to locate the copy either. So I kind of feel like we've exhausted a lot of avenues. So at this point, rather than spending a lot more staff time trying to find this, and we've spent plenty of time looking for it already, that we would come back and request that delegated authority. So I'll be happy to answer any questions.
Okay, we're going to go around the room. I'll start over here. And first off, we'll start with Shannon. Shannon, do you have any questions?
I'm just not clear exactly how this is, how did it get lost? Can you address that, Jeff? Or
No.
misplaced, I assume.
I don't know. That's a great question.
Okay, that was my question.
Okay, I'll go around the room this way, starting with Manager May. Questions over here? Question?
What is the date of the document that we were looking
It
for?
was issued in December of 2018.
2018. So it's clearly a while ago. What, almost 7 years, 6 years ago? 6 years ago. My only questions are, clearly that's a long time ago. There's a whole different process for document storage and management. So I'm guessing we have, the question is, we have knowledge management and contract management and document management systems in place that this stuff doesn't, because I don't see it happening very often. This is obviously an outlier, but would you say that between then and now we've got that issue corrected?
I would.
Yeah, okay, okay, yeah,
And I will say that, as it relates to these type of documents, that yes, we are much more cognizant of essential documents and the storage requirements
Well,
and
then-
retention requirements.
That makes me feel fine. I appreciate that we work in a system where you come to the board, even for something like this, where it would seem obvious that the CEO could just ratify that. I'm really glad that we're working in a system with this kind of transparency where you come to the board to still ask us anyway for what seems like a formality to allow the CEO to execute that document. So thanks.
Do you have any questions? I have one or two, and then I'll keep going. So help me understand. This is a document that the board would have voted on approving, and then delegating signature.
So we budgeted explicitly for it.
Yep.
I am almost sure that we did. This is what I think happened. If I can speculate a little bit.
Sure.
I think we had a closed session presentation, and we probably came out of closed session and voted on it at the very end of the meeting, and that snippet just didn't get captured. That's only speculation. And I think David has looked and his staff has looked on agenda items, and we have generally some Sendero items, but nothing that's so specific that it says Sendero surplus debenture number 2.
Okay.
You know.
And second question, just because I'm not familiar with these instruments, what exactly are we signing? Are we asking Dr. Lee to sign? And in other words, what kind of document is it? Is it a legal document that establishes a debenture, or is it a document that says what the board voted on? What kind of document is it?
Yeah, it's really it's a Texas Department of Insurance document.
Okay. It's
more of a capital item that's executed by insurance companies. And so on the insurance side, even though it's technically it's a liability to the insurance company, it's subordinate to any other liability. But it is an actual document that TDI, it's a TDI instrument. It is a debt instrument. It's used for capital, and I'm not aware of any other use of those type of documents other than for this purpose.
Okay, so it's filed with TDI, and there's no
Yes.
other entity that it's filed with?
That's correct.
And it's not a bank instrument?
No.
Okay. And then the last question is, how is it to be handled, because we're backdating it, right? In other words, how are you going to sign something that happened 7 years ago now with a new CEO? What's the thinking there?
My thinking of it, and David, feel free to chime in, but my thinking of it is that the board authorizes Dr. Lee to ratify it. That's documented, it's dated the date he signs it.
Okay.
And that's the documentation that we use in the event that either from a regulatory standpoint,
Okay.
We need to produce the document.
Okay.
The only other reason I can think that we might need to do something is if we ever in the future need to go and amend the venture number 2, similar to what we did with number 1, we have the document that's been executed, and we have a central health authorized signature on it,
Okay.
on a document.
Okay, then the last question is, do we have something in writing from TDI that has approved it?
Yes, we do.
Okay. All right. Those are my questions. Do you have any questions?
No questions.
Cynthia, Manager Valdez, do you have any questions?
Thank you, I do. That would have been, during Mike's term, he would have been here a little over a year, I guess, almost two, for his evaluation. And he was a commissioner of Texas Department of Insurance, so he should have known. He would have known. It's like you said, things happen, documents disappear. I'm surprised that there weren't any minutes that would have reflected this. At that time, we were taping our meetings. Is there anything in the meetings that would, in the tape, that would have shown that this occurred? It was a
Again,
taped meeting.
Again, on just from the agenda standpoint, these were closed session items, and it was general Sendero, receive and take appropriate
Right.
action related to Sendero. So I don't have anything more specific other than just some documentation that alludes to it being executed. But again, I can't hold the document and see the document, so that's what we're asking to.
I understand, but at that time, we were taping our executive committee meetings. It wasn't until David Duncan and Dr. Bell made a decision to stop taping our Central Health executive session meetings, maybe about 2 years ago or a year and a half ago, that occurred. But prior to that, we were taping our meetings. At least they were using a different recorder, if I'm not mistaken, to record those. So I'd like to know whether or not a tape exists. And at the very least, coming out of executive session, a motion would have had to have been made, and there would have been minutes that would have recorded that passage. So I'd like to see where those are. And I would also, the reason I'm saying this is because stuff happens. Things disappear. And they may have been done, but they may have not been. I don't know. And I would like for us to consider that in light of what we are dealing with at Community Care and have dealt with in the past at Sendero. So I'd like for the record to reflect my concerns, and I'd like to know whether or not there are tapes or minutes that reflect that.
Okay, so if you guys, appropriate people, would check on that and get back to us to let us know. Okay, Dr. Zamora, do you have any questions?
No questions, just a statement.
Okay,
My apologies to this board and to this audience, because that would have been under my watch.
okay,
So the buck stops here. If,
Okay.
if we lost something, it's my fault, because I was chair. I'm pretty sure I was chair, wasn't I?
Yeah, this isn't casting, I don't have any assurances that the document was even signed. I have a signed version from Sendero. I just don't know that I've looked. I just don't know if that document exists. So I don't want you to think that this is this is something that would have existed and somehow it disappeared. There were things that were done. There was a lot of capital requirements at that point for Sendero, and things, again, we budgeted, let me go back and reiterate, we did budget for this. We knew it was going to occur, and we budgeted for it as a surplus debenture. So there's no doubt in my mind that everyone was aware of it. It's just, again, I can't hold the actual document.
okay. All right,
So, one last thing.
Oh, yeah.
So, I trust in you, I trust in our staff, so I believe in you, Jeff. Thanks for looking. You're doing a great job.
Parla did most of the looking to give you all
So,
the credit.
I just want to say, I appreciate all this. This is an example of when things can happen. There was no
Yes.
intent here and no fraud, nobody trying to do something wrong. It just happened. So I think we should remember that can happen sometimes. And I think others have said that the system is maybe in better shape this time now to make sure this doesn't happen again. Okay, I need a motion. So I have a motion from,
I move that the committee recommend the board authorize the Central Health President and CEO to execute. Oh, I'm sorry. I move that the committee recommend that the board authorize the Central Health President and CEO to execute the surplus debenture number 2 with Sendero Health Plans, Inc.
Okay, second from Manager May. All in favor?
Aye.
Okay, it passes. All right, we're going to move on now to the last item, which is to confirm the next Budget and Finance Committee meeting date and time and location. Managers, our next Central Health Budget and Finance Committee is tentatively scheduled for Wednesday, October 23rd at 4 p.m. At Central Health Headquarters, 1111 East Cesar Chavez. At this time, I'm ready to accept a motion for adjournment. Motion from Manager Martin, second from Manager Valadez. All in favor?
Aye.
Okay. All right, so we will now move on. Okay, so good afternoon. Today is September 25th, and it is 4:23. As a quorum of the committee, we're moving on to the executive committee. As a quorum of the executive committee is in attendance, I'd like to call to order the meeting of the Central Health Executive Committee. And we're going to hold public communication for the Budget and Finance Committee, Executive Committee, and the Board of Managers after this meeting. We'll now proceed to the Executive Committee agenda. First item is to approve the minutes of the Central Health Executive Committee, August 21st, 2024. Motion from Manager Martin, second from Manager Brinson. All in favor?
Aye.
Aye. Okay. Second item, review and provide direction to staff on the prioritization and tentative scheduling of items for consideration at future Central Health Board and Committee meetings, including board retreats. So I think Brianna is going to go over the upcoming agenda items, and then Perla's going to go over, Perla's going to give us a status update on the retreat. So whichever order you all would like to go in is fine.
I'll just quickly go over the October agenda items. So in October, we'll have strategic planning on October 16th. We'll do the minutes. We'll receive and discuss an update on Central Health's communications, engagement, and outreach efforts. Medical respite at Cameron Road, street medicine mobile clinics update, and shared goals with CUC, Sendero, Central Health, including cancer screenings and preventions, and eligibility and enrollment. That's strategic planning. And budget and finance on October 23rd. We'll have the FY 2025 CUC budget, CUC quarterly report, and a budget process review of this past year's budget process. For executive committee, we'll just have our standing tentative schedules. And then for the board meeting, we'll have a public hearing for the LPPF rate setting. And then we'll have an update, a status update on the FY 24 early wins for trust. And then our standing updates, performance review, lawsuit, updates, CEO settlement authority, and then budget resolution updates, kind of to close out the FY 24 updates.
Okay. Perla.
Good afternoon. I just wanted to provide a brief update on the board retreat, which we've been talking about for a few months. Some staff met earlier today. We are moving forward with looking at the month of November for a board retreat. We're looking at the three, and Brianna will reach out to you to do some polling, but we're looking at the middle three, Friday, Saturdays in November, so the 8th, the 9th, the 15th, the 16th, or the 22nd, 23rd. Based on what the board has provided staff in terms of the topics that you're interested in covering, and just some conversations that we've been having with staff about the future of Central Health. We think this might require a day and a half. So we're going to go ahead and look at both, a Friday and a Saturday. And that the goal really of this retreat is to come together and hear from the board about, your vision and providing some direction to staff around what we the board and the executives would like to see for the future of the hospital district. The healthcare equity plan has built in many pieces of that, but there are still some areas that need some development and discussion. In addition to that, I'll just outline a few of the topics that the board has shared with us that you would like to cover at the retreat. What we've heard from you is that you would like to have a conversation around what other hospital districts are doing and how they operate. We've also heard from you that you'd like to learn more about Central Health's approach to healthcare equity. We've heard from you that you want to look at some projections for how the city of Austin and Travis County are growing over the next 15 years, including population health and community health. I think the majority of the conversation will likely align around what we expect Central Health to be over the next 15 years as we mature as a hospital district system. And so we have, multiple, I think, components to that. And one thing that I heard you all say at a recent board meeting is you also want to discuss diversification of revenue. That's something that came up recently. So we've added that to the agenda as well. So we're fleshing out these topics to make them, flow coherently in a conversation. We'll be selecting a facilitator to help ensure that each board member has their voice heard and participates in the conversation. And that's what I have for now. Pat, did you want to add anything to that?
I think that was a really good summary, Perla. I think the overall goal is we want to make sure we have deep conversation with our board, possibly a series of conversations with the goal of arriving at a shared vision together of where we need to go and where we are heading over the longer term. So that's really the intent. And so we'll take a first step here. It may be that we get it right, maybe that we need to adjust, we'll do that. But we'll know we're successful, I think, when as a board we all feel aligned and excited by and committed to that vision of where we're going.
I would add a few things.
Sure.
Did you? Okay.
Yes.
So the topic list that you went through is taken from the memo
Correct.
that was sent out to all of the board members. So y'all have that. And this is a dynamic process. So if you take a look at that again, and if we miss something, just let us know. But it's taken from that list that we talked about at a board meeting we had a while back. The other thing is that this is a process with a facilitator, as Perla said, and the purpose of the facilitator is to help us all reach consensus. And the other thing that the facilitator does is it frees up the staff to participate with us. So it's not run by the staff, but they can participate with us and in the conversation. So that's really important in doing a retreat like this, and that's why we need a facilitator to run the meeting. It may make sense for staff to make some presentations to us. So in terms of content, so we all have that to inform our conversation. So we'll do that, but we'll also have them participate, because we want to hear the ideas of staff also. So that's the point. And I also want to emphasize something I think one of you said, Perla, is that the future of the hospital district is something that, off and on we've been touching on in different conversations. So this will give us an opportunity to really focus on that. And that includes things like eligibility and MAP eligibility and things like that. So it also includes hospitals. There have been off and on conversations, not with our board, but we get asked from time to time by commissioners or by people in the community, are we buying a hospital? Yep. We have not had that conversation yet as a board, so this is our opportunity to do that. And we want to come out of that with some understanding about that, and how that fits with the overall vision. The other thing is we also want to talk, I think it will be important as we talk about that, whatever the vision, the board and staff reach consensus on, is that we need to talk about how we talk to the community about that, because I think it's really important to think about as we grow and develop and all of that, that kind of vision needs to be shared with the community, particularly around that question of, are we going to operate a hospital? Because the community is already asking about that. So if we're going down that road, we need to be going down that road together. And we also need to understand how we engage the community in going down that road. So again, I'm not presupposing any kind of answer to that. I'm just saying that that'll be one of the major topics for us at our retreat. Yes, we'll start this way.
Okay.
Okay, Dr. Zamora, you go first. Nope. Manager Valadez?
I know that Shannon and I have both brought up the issue of what is our different definition of equity,
Yes.
and how are we going to use demographics and equity to address the strategies and the initiatives and the how we're going to provide health, to our community, especially our marginalized populations. We've also had a conversation about what are we doing with the Brackenridge Tract.
Okay.
And in light of recent conversations, I have personally believe we have some major gaps that need to be closed with respect to personnel policies and with respect to central health, to the enterprise, to community care, and to Sendero. And I'd like for us at some point in time I think that's one of the ways.
I think that needs to be on the agenda. The relationships, if that where you're going.
Well, and the relationships with the various boards, but I'm specifically talking about some gaps.
Okay.
Because when we were requesting copies of the personnel policies, we got them piecemeal. Some were relevant, some were not. Madam Chair, and I'd just like for us to have a conversation about what do we want Central Health to look like? What are we going to be providing and looking for our employees to be taken care of, and those of the enterprise? And so the only way we can do that is to make sure that there are appropriate policies in place that will make sure that the environments are positive and productive, and that the employees' rights are protected for the benefit of our agencies. Okay, so that we don't experience any backlash or possible action against us.
Okay, so Perla, if you could make sure, I know we have down there relationships between, but please add to that employees, and the other level of detail that Manager Valadez just mentioned.
Okay.
So, thank you.
And one last thing, just with respect to that, how are our employees, how is their career ladder developed? And if we have a static top level, how are people going to be able to grow into higher positions if we remain static at the top?
Okay.
Thank you.
Okay. No questions. Okay. Any comments?
I was just going to ask that make sure the staff was going to be there.
Oh yeah. Well, that's
And
what
then,
I.
I think that the segue, the tract of real estate, the medical school, and our integration or work with UT
Okay.
to bundle that concept, I think is important.
Okay.
So that's all. Thank you.
You got that right, Perla?
Yes.
Okay. Amit?
Thank you.
Manager May? Lisa?
No.
Shannon?
Yes, I have a couple of comments if I might make them.
Okay.
First of all, I've been asking for these retreats for quite some time, and I appreciate that we're about to begin on them. I think we should have at least a 3-day retreat. Now, they may not be all consecutive, but I think we need to have it. The first one to focus in on, and I think it's very important for us to understand, how did we get to where we are today?
Okay.
I don't think the public understands it completely, and I don't think many board members understand. Having done that, then I think we need to spend some time talking about the model that has been put in place. Is this the best model? And in discussing that, I think we need to look at other districts around the state. We are unique in that sense, and I think it's important that we, all board members, understand the uniqueness of those factors. So I would think maybe a day devoted towards what other districts look like, how could we work from those and the like. And then finally, I think we need to spend a little time, okay, then what should we look like based upon what we have learned, what we currently have, what other communities are doing, and then what is best for our community as we go forward. Because I think that we don't want to rush through this process. We've been at it 20 years. We don't find ourselves 20 years, well, those who will be here 20 years from now, revisiting this issue again. So those are my major comments particularly.
Okay. All right, everybody, thank you. Those are all very helpful comments.
Thank you.
Okay, so we will move on now to the third item, which is confirm the next regular executive committee meeting date, time, and location. Managers, our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, October 23rd at 4 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez. At this time, I'm ready to accept a motion from adjournment from Manager Martin with a second from Manager Brinson. All in favor? Aye. Okay. All right. We are going to move on to our Board of Managers meeting. Good evening. Today is September 25th, 2024, and it is 4:39. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. Now, we have a time certain at 5:30, but I think we could take it earlier because there are okay. Yeah, we only have sign up from for our mission moment this morning. So with staff, and I think they probably would appreciate doing it earlier. So we're going to go ahead with we're going to proceed with our mission moment.
Perfect. Thank you, Chair Kitchen. Up first, we have Kent Kaziski, who's our Enterprise Diversity, Equity, and Inclusion Manager. Is he in the room? Oh, I think he was walking over. Okay, then in the meantime, I will call up Priscilla Macias, who's our BSN, RN, CCRN, SCRN, RN Navigator Supervisor.
Okay. Welcome.
Yeah, that'd be great, actually.
Welcome. We really appreciate you coming to talk with us today.
Yes, absolutely. Thank you for having me, and I'm happy to share today's my 1-year anniversary with Central Health, so I'm very happy to be here. It's perfect timing. So, honorable board members, my name is Priscilla Macias, and I am deeply honored to share my journey with you today. My story began in the Rio Grande Valley, a border town in South Texas known for its cultural richness, but also its economic challenges. Growing up in this vibrant yet underserved area, I experienced firsthand the profound impact of social determinants of health. My family faced numerous obstacles shaped by our socioeconomic environment, including limited educational and financial resources. The Rio Grande Valley faces severe health disparities, with one of the highest poverty rates in the nation. Nearly 30% of residents live below the federal poverty line. Educational attainment is low, with about 1/3 of adults lacking a high school diploma. The region also struggles with high rates of uninsured individuals, which contributes to poor health outcomes, such as diabetes, obesity, and cervical cancer. Additionally, the healthcare infrastructure is strained, with limited access to specialists and preventative care services. Despite these constraints, my parents, who achieved the 6th and 11th grade in their education, worked tirelessly to provide for us. My father juggled multiple jobs as a mechanic and part-time worker, while my mother dedicated herself to managing our household. Their sacrifices and unwavering support instilled in me the value of education and resilience as a means to overcome barriers and achieve success. The turning point in my life came when I was 13 years old. My father was diagnosed with type 2 diabetes, a pivotal moment that profoundly influenced my path to healthcare. As the primary translator between my parents and healthcare providers, I was thrust into a role that exposed me to complexities and challenges of navigating the healthcare system. My father's limited English proficiency and understanding of his condition revealed the systemic barriers faced by underserved communities. During this challenging time, I observed, as a 13-year-old, how the healthcare system often failed to provide culturally sensitive and accessible care. Medical advice and treatment plans were not tailored to my father's specific needs or background. Frustrated by the lack of personalized guidance and support, I took it upon myself to bridge this gap. At 13 years old, I educated myself about diabetes management, consulting public library books, our school nurse, and a local nutritionist recommended by resources that I sought out. This proactive approach not only helped my father, but also ignited a passion within me for patient education and advocacy. This experience highlighted the urgent need for healthcare professionals who possess not only clinical expertise, but also deep empathy and cultural awareness. Observing my father's struggles with the healthcare system that lacked sensitivity to his background and needs made it evident that effective care requires more than just technical skills. It requires a genuine understanding of the patient's unique context and challenges. This realization sparked a profound desire in me to pursue a career in healthcare where I could address these gaps. It became clear that I had both the compassionate heart of a nurse, which I'm a nurse at the moment, and the analytical mind of a provider, making the path to becoming a nurse practitioner a natural and passionate calling. This drive combined clinical skills with empathy and cultural competence has since guided my professional journey and commitment to improving patient care. This motivation led me to become the first in my family to graduate from high school and college, earning a Bachelor of Science in Nursing and now completing a master's degree to become a nurse practitioner. I graduated in this December, and I'm counting down. My professional journey includes extensive experience in neurocritical care at esteemed institutions within the Texas Medical Center in Houston, Texas. I've been a nurse for the past 5 years. I have specialized in neurocritical care, neurosurgery, end-of-life care, managing complex cases with life-saving skills. My achievements encompass palliative care, hospice care, organ donation processes, and I have received multiple honors, including the Daisy Award, along with certifications with critical neurology care and stroke management. My journey from Rio Grande Valley to becoming a nurse practitioner has been a deeply personal and transformative experience, driven by an unwavering commitment to overcoming barriers and effecting meaningful change in healthcare. Growing up in an underserved community, I experienced firsthand the challenges and disparities faced by those similar in our community. This personal connection has fueled a profound understanding of the systemic issues affecting underserved populations and has shaped my approach to healthcare. This mission closely aligns with Central Health's goal of enhancing the health and well-being of these communities. By collaborating closely, we have the opportunity to address and bridge gaps in our communities and advocate effectively for those who are often marginalized and ensure that every individual, they don't just receive treatment, but compassionate and personalized care tailored to their unique needs. Utilizing a human-centered approach aims to create a more equitable healthcare system where every person has access to the quality of care they rightfully deserve. Thank you for allowing me to share my story and my passion for healthcare. I am deeply committed to Central Health's mission and look forward to contributing to a healthier, more equitable future for our community.
Thank you. Thank you very much.
Madam Chair, may I ask, Priscilla,
Yes.
where are you from?
I'm from Westlake, Texas.
Oh, I'm from Mission.
Oh, okay. 956.
It was originally 512 was the area code also.
Oh, wow. Small world.
Anyway,
Thank you all.
Thank you very much.
Thank you.
felicidades.
Gracias.
Thank you, Priscilla, and congratulations. Up next, we have Kent Kaziski, Enterprise Diversity, Equity, and Inclusion Manager and team.
All right, so I'm here just to introduce Adriana Gomez, who is our DEI Council Chair, as well as Francisco Zavala, who is our Community Care org rep, who will be highlighting Hispanic Heritage Month as festivities that we're doing for our employee population. So I'll hand it over to them. Sorry? The power and the slide, please. Thank you.
Hello.
We can hear you.
Awesome. Well, good afternoon, everyone. I hope you all are doing great. Thank you, Kent. My name is Adriana Gomez. I am an eligibility department trainer with Central Health, and I am this year's DI chair. And I'm also co-leading the Hispanic Heritage Month initiative with Francisco. So we're just here to give you a quick update of what we're doing and share some information about the different events that we're going to be having for our enterprise staff. We're very excited about it. So there's going to be system-wide initiatives, and these initiatives are going to be highlighting the shared customs amongst the different countries that are being celebrated during Hispanic Heritage Month. And we try to, pinpoint 3 of those, which were music, food, and cultural traditions. Something else that we're trying to do is anytime that we have an initiative through DI, through our DI council, is making sure that we're taking into consideration the different workflow from the enterprise entities. So making sure that we are providing an opportunity for everyone to participate, whether it be virtual, in person, hybrid, and also including an educational component. So we're going to be asking for dance tutorials. For in-person, we're going to have some potlucks going on in our different locations. And then hybrid, we're going to have a piñata contest. And for education, we're going to be doing a Como Se Dice campaign, which Francisco is going to be talking about these more.
Hi, all. My name is Francisco Zavala. I'm a senior financial analyst at Community Care. And as Adriana and Ken mentioned, we're going to be having a few events going on in observance of Hispanic Heritage Month. And so just a little highlight on what was already mentioned. We're going to be having the virtual dance tutorial for the people who's not presential in the office. This is going to give them the opportunity to participate by submitting a short video of a traditional dance of their country of origin or of ascendance, and just give us like pointers, so that way we will be able to show off the next party when we all assist. In person, we're gonna have the potluck, as Adriana mentioned. There's gonna be in several locations, enterprise-wise, and similarly, it's gonna highlight dishes from all the different countries that are part of the Hispanic and Latin countries. And the piñata contest, which is going to be a hybrid. We're going to do it presential and virtually. We're going to have a tutorial to create a small piñata, and the best one, well, there's going to be a submission of pictures once the piñatas are completed, and the best one's going to be the winner. Spoiler alert, it's probably going to be mine, but I don't know, it's up in the air still. And yeah, we're also going to have the Como Se Dice campaign. And this is also to highlight how we are all different and similar at the same time. We're going to try to highlight all the words that are different, or all the different names for the same thing within the Latin and Hispanic countries. Something that may be called by a name in one place may be called by a different one in a different country. So we want to share that and educate ourselves, know a little bit more about all the languages that are spoken within Latin and Hispanic America.
Yeah, we're very excited about the upcoming events, and we're looking forward to creating the space for staff to participate, for everyone to have the opportunity to participate and be involved.
Thank thank you very much. I mean, it sounds, I want to come to the potluck.
Always.
So,
You're welcome to come. Come and try all the dishes. We want everybody to bring, their favorite dish. What does it mean to you? Include the allergens in there because, we want to make sure nobody gets an allergy reaction. But yes, we're excited and we are definitely looking forward to seeing the different dishes. Everybody has a favorite dish, right? So we're looking forward to seeing that. So come on over. Choose one of the 3 sites. Let us know and we'll give you the information.
okay.
Do want to highlight too, we're using these as opportunities to integrate into our clinic system as well. So we're having it at Hornsby Bend, the new location there, Southeast Health and Wellness, in the future Del Valley, and also working with Community Care on their clinics as well to make sure we're getting to the clinical staff to get those celebrations out there too.
That's great. That's wonderful. Thank you.
Yes, and I think something that Kent also mentioned in the information that went out to staff, like we pinpointed 3 locations, but we also want staff to know that if their location's not one of the ones on the list, they can reach out to us, right? We want to know, like, hey, if you want to participate, let us know so that we can make it happen where you are at. So we're trying to make sure that anytime we do any type of initiative, that we're making it accessible to everyone.
That's great.
Thank you.
Thank you.
Thank y'all.
Thank y'all so much. And this concludes our mission moments.
Thank you all. This is really, really nice. Okay, we will now proceed to the consent agenda. Members, for item C3, Mr. Katz was not available when the Ad hoc Appointments Committee met on Monday, so his reappointment will be scheduled for a future meeting. And we are only acting on Dr. Zamora's reappointment per the committee's recommendation. So we have 5 items on the consent agenda. Do I have a motion to approve the consent agenda? A motion from Manager Valadez, second from Manager Motwani. All in favor?
Aye.
Aye. Okay. We'll now proceed to the regular agenda. The first item on the agenda is to discuss updates on matters related to a performance review contracted by Travis County, including delegations to the President and CEO to execute necessary agreements between Central Health, Travis County, and Mazars. Monica Crowley will be presenting. Managers, this is an update to talk about some next steps. I'm introducing you, Monica. This is an update to talk about some next steps on the Mazars report. So,
thank you, Chair Kitchen and managers, Monica Crowley. And I'm here to let you know we had the results of the Mazars review that I think were presented in the public hearing at Commissioner's Court 2 weeks ago. Since that time, we're taking the report and as we said in Commissioner's Court, Central Health is moving forward and already has moved forward in addressing some of the findings that Mazars had in the report, and to the extent that Central Health can take Mazars' recommendations and implement them unilaterally, we are moving forward with implementing those findings. Also, some of the findings, as we had addressed previously, were findings that we believe are in error and that there are no steps that need to be taken. We're working on creating a tracking document, tracking each finding, and Katie Coburn and Jeff Knodel and Mackenzie Frazier are going to be working with us on creating this tracking document that includes all of the findings, the steps to be taken either to implement the findings or the note that we already made about why the finding is something that we don't believe that there's action to be taken, and kind of doing the red light, green light, stoplight form of where we are in implementing that finding. We would propose to come back to the board in November with that tracking document with an update on where we are in making the changes. One of the recommendations that Central Health can't implement unilaterally, but that Dr. Lee and you, Chair Kitchen, discussed yesterday when we were at the Commissioner's Court was related to tracking the Dell Medical School performance. And I think, and Pat, you can correct me, I think there were 3 takeaways that you read back to the court, and that you guys are making follow-up appointments with Dean Lucanetti to make sure that we're getting the input from the court on what needs to be updated in the reporting matrix, but that we would have an updated reporting matrix by the end of this calendar year that at least includes information about how care for low-income populations served by the Dell Medical School and Central Health has been improved in the areas of access, service delivery, staffing, and funds flow over the past 3 years, and then additional information about how the dollars are being spent. And that's all I have for now. Pat?
I want to clarify a few things because for those of us that are newer on the board, the reporting matrix, and do just tell me if I got it right. The reporting matrix that we're referring to was started a few years ago. It was an effort started in 2022, I think, and spilled over to 2023. And it was an effort that came out of a resolution that was passed by this board. And it was an effort to kind of delineate a list of types of reporting that I think Mike Gieslin and you guys as staff went through a process of working with Dell Medical School to try to develop that list. I don't think it was ever completed. There were changes in leadership all the way around at Dell as well as here. And so that's the reporting, if I'm understanding correctly, that's the reporting matrix we're referring to. So you guys are going to update it, work with the medical school, and come back to us by, I'm sorry, I didn't hear what you said. Was it the end of the year or, okay, by the end of the year. And also I think we tell me if I got this right, I think we committed to share that with the commissioners, right? Okay. And so the hope, of course, is that, the reporting matrix really has to be a collaborative deal, or at least has to be agreed to, because basically what it does is it lists the kinds of things that Monica mentioned, and then it delineates certain documents and data from Dell Medical School. So it'll be a back and forth process to make sure we can check and get all that information right.
Dr. Lee, can I just clarify one piece? The matrix as designed was something that was really spearheaded by Dr. Charles Bell.
Oh,
and
it was
based upon the obligations in the affiliation agreement. If you look at the matrix, each number is based upon a section of the contract in the affiliation agreement.
Okay.
And then staff and the CEO at the time worked collaboratively with folks from the University of Texas President's Office and then from the medical school on trying to find information that would be an appropriate measure for each of those areas in the affiliation agreement. And I think one of the things that we have an opportunity now with Dean Lucanetti, if there is a desire to kind of go beyond what's just on the face of the agreement so that we can find a better way to, to report on what's changed, what's improved, and how the money is being spent.
And there was one thing I wanted to mention from the commissioners that came from Commissioner Trevelyan, that he mentioned, he actually mentioned a program in New Orleans, I think.
Xavier?
It was SOAR, I think.
SOAR, S-O-A-R.
Yes, and what he was talking about is the opportunity to, potential opportunity to develop a program similar that's really designed around opportunities for local, young people locally to be engaged with the school and develop their skills and stuff. Is there anything else you would say about that? Or?
I'll just build on these comments just to share. For those who may not have had opportunity to see the remarks yesterday morning, we did actually digest, a couple hundred pages of DMS reports to us and try to pull out the salient features. So we did kind of summarize, and we have that deck we can share, or the recording of that presentation. My sense
It'd probably
from
be good to share that deck with the board.
Yeah,
so-
I think we can happily share it, and
Okay.
even an easy link to take a look at the recording. I think I heard from a number of the commissioners that it was useful information. They appreciated what was shared there. They could see that it was valuable. So there was value there, and really the thought here is sometimes we might end up not too far from the actual content eventually, but if we get there in a more inclusive, responsive, personal fashion, it can feel very different. So the hope here is that Dean Lucanetti and I can actually personally meet with each of the commissioners and perhaps other key stakeholders, and there might be staff involved here, but we build the design of the report more inclusively so that the process of saying what we're going to measure is a more inclusive process. And then we go out and measure it, and it might feel quite different because some folks will sort of have fingerprints on it, authorship over it, and say, yeah, this is what my community needs to hear, and the way that it's going to be helpful to hear it. So that's really my hope here, is that we can better communicate the value that I think is clearly there, and many people see it, and even Commissioner Shea spoke to it, that every physician in the community that she speaks to is clear. This is very valuable. It makes a big difference, but we've had an opportunity to improve how we communicate it, and even how we build the design of the communication tool in an inclusive and personal way. So I think that's what we're aiming to set out and do here.
So let's think about, y'all look at your timing about when you can bring that back to the board, because it'll be important to get the board's input on it before you talk to the commissioners. So I think that'll be really important. So if you were thinking of talking to the commissioners in December, then bring it to us in November, or whatever the appropriate timing is.
We'll
Because
definitely share it with all of you, yeah.
Well, we need to share it in a meeting so that the board can go through it and also provide their comments.
Okay.
Okay. All right. All right, anything else, Monica? All right, I'll go around the room and I'll start this next time. Shannon, do you have anything?
Yes, I just have one question. I've heard through various sources, validity of it, I don't know, of the credentials for Mazars to have conducted this. Has that been discussed at all? And is there any validity to that? It was disturbing when I heard it, and I just thought I would ask.
Go speak to that.
Meaning that.
So Mazars was engaged to conduct an outside audit or performance review by Travis County. Central Health was not part of the drafting of that scope of work, nor was Central Health part of the procurement process or of the engagement. So at the time, they were presented as a reputable outside audit firm that responded to that procurement process and were engaged by the county.
Well, yeah, I'm not questioning that. I'm just saying that I've heard sources questioning that their appropriateness to have done that. That's why I've asked. The rest of it is, I agree with you, Chair, is that we do need an opportunity to review those. I think there were some excellent recommendations, and I agree with the commissioners that some of them can be incorporated with some of the institutions here as well. And then finally, certainly, as we talked about earlier at our retreat, looking at and trying to examine whether or not our district and our relationship with hospitals, and particularly here in Austin with Dell, what kind of relationship that would be very valuable in terms of their recommendations as well.
Okay.
So thanks for
Okay, Manager May?
Just from listening to the presentation that Mike had put forth, I like the idea, and that's even, it's already started to take place. Oh, I'm so sorry.
I can't hear Manager
My
May.
apologies, Shannon, my apologies, managers. Anyway, I like the idea that has already been put forth, and I'd like to see it evolve even further. And that's the idea of taking the affiliated agreement that we have with, I think you said it was with UT, and then doing the matrix, establishing a matrix off of that affiliated agreement, because that's gonna be our best opportunity to really see if the services and if, to see what is being delivered, and then we can better gauge and judge for ourselves if we're getting our money's worth, for lack of a better way to say it.
Okay, thank you. Manager.
Appreciate the allusions to the matrix. If I recall correctly, that was born of the notion that we couldn't obviously unilaterally sort of renegotiate the agreement or decide we didn't want to cooperate with the agreement or put any kind of conditions or terms on the agreement, and that, if I recall correctly again, was from the advice of counsel, who reviewed the agreement and told us that we had no recourse. And so appreciate the recommendations of everybody, while understanding the limitations that I believe that we're under, having inherited the agreement. And therefore, I think that that matrix was a great start to finding common ground, because it alluded to the sections of the actual agreement and looked at potential ways that we could constructively work together. So I believe that that was born of the notion that we were sort of limited legally. Thanks.
Okay.
May I, the one clarification that I'd like to make is, it is explicitly clear, one of the reasons that the, matrix was built around the University of Texas obligations, and reporting is because, there are obligations that UT has. Central Health as a board does have recourse to enforce those obligations. Central Health as a board does have appropriate oversight of those obligations that are in the agreement that you are conducting as part of that agreement. The thing that we don't have the ability to do based on advice of counsel is to unilaterally amend the agreement. So, but there is significant oversight that is reflected in the agreement, and tracking that oversight was, as you noted, kind of the hub, the foundation of
Yeah, it
the
just seems like
matrix.
it's the most fertile ground for us to be planting on. Thanks.
Okay, okay, Manager Ward.
Yeah, I'd like to allude to what Shannon had spoken about. And what I had read, I think the charge against the Mazars is the practice of law. And I was just curious how that would affect their final report, that Birch and all filed a complaint that that Mazars had practiced law, and where that might be of true value, or if it affects their review.
I'm going to defer.
Okay,
to-
I don't know. I'd say,
Absolutely, I think as we're going to
my
be,
point is,
and I don't know if that we're not in closed
Right.
session now, and I think if we're seeking kind of a legal opinion from counsel.
when that's what I was going to
yeah.
say, is we go to closed session on this issue, but it was in the paper, so
Yeah.
the issue is open. So if we need to discuss things privately, that's fine. But I just was curious what that might align us, so we can discuss that later. The second thing I had
Okay.
about the matrix, I think that our new dean is very cooperative and willing to work with us, and I think if we can take actionable data to them, that we will be able to just nurture an increasingly mutually beneficial relationship. And so I'd really support that. Thank you.
Okay. Manager Brinson?
No questions.
Manager Valadez?
Commissioner Trevelyan and the other commissioners did make some very good suggestions. Commissioner Trevelyan specifically said, I want to see us go back 3 years, and I want to see what we're doing now. And he also liked the idea of, give me the number of people in our targeted population that you are actually providing services to, which is something that no one is talking about. Nobody's saying, oh, we say in general terms, oh, we're providing this good for the community, blah, blah, blah. But we're not going to tell you because we don't collect the demographic data, and we don't ask how much, whether they're on any insurance or what their income is or blah, blah, blah. So they just need to start collecting that information. If they can sit there and say, oh, well, we've treated 200,000 people. Well, you wouldn't have been able to do a count unless you knew how many people you were treating. So they could very easily accommodate a request by Central Health and you know, Dr. Lee and Ann, if y'all could make sure that they understood that we're looking for the community benefit, because those were the terms that we came forward prior to that contract affiliation agreement being signed. We wanted to see what the community benefits were. We even made suggestions as to what possible community benefits could be incorporated into that.
Okay.
And another thing, the 3 years plus that data, and what else? Oh, just to make sure that they began reporting in some way, shape, or fashion to Central Health and to the public that this is how we're spending our money. Me personally, I wouldn't sign another contract with them until I knew that they were providing us with the information that we had requested. And if I'm not mistaken, the affiliation agreement can be terminated at the 25th year so long as they receive notice within 1 year of the expiration of the affiliation agreement. That's what I remember reading. And so we do have some leverage, but we don't want to necessarily go there unless they're going to change their ways. But they have to change their ways significantly, because their way right now has been their way, not ours. So thank you. But I do appreciate that, and hope to God that they understand that they're doing this for the betterment, not only of the optics of UT being a bully, but also that they are providing services as it was supposed to be, according to the words of the 10 by 10 plan and Watson. They were going to be provided, and Trish Young Brown, who herself was quoted in the paper publicly of saying that they were going to be providing services to indigent care. So, thank you.
Thank you. Dr. Zimworth?
No questions, just I agree with the board. We need to hold them accountable. It's about patient care, bottom line.
Okay. Okay, thank you. We're going to go into closed session. We'll ask your question first in closed session. So let me move us into closed session. Okay. I announce that the board is convening in closed session to discuss agenda item 1 under Texas Government Code Section 551.074 Personnel Matters, and our Texas Government Code Section 551.071 Consultation with Attorney. Agenda item 2, 3, and 4 under Texas Government Code Section 551.071 Consultation with Attorney. All right, going into closed session. Ready? Okay. It's September 25th and the time is 8 o'clock. And managers, there are no motions necessary out of the closed session. So we are taking up the last agenda item, which is agenda item 5. Confirm the next regular board meeting date, time, and location. Our next Central Health Board of Managers meeting is scheduled for October 23rd at 4 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez. At this time, I'm ready to accept a motion for adjournment from Manager Brinson, seconded by Manager May. All right. Thank you all.